Good day, nurses. Today we're going to continue, discussing your antihypertensive medications. Okay, we still have at least two, di ba? We have your sympatholytic drugs and of course your direct vasodilators. Okay, so let's discuss first the sympatholytic drugs. Okay, when you say sympatholytic drugs, okay, from the word itself, sympha, okay, we are pertaining it to your sympathetic nervous system. Sir, how does our sympathetic nervous system affects our blood pressure, di ba? Pag na-activate natin ang ating SNS or your sympathetic nervous system, ano ba ang mga natin, effector organs natin? Okay, yung mga blood vessels natin, di ba? And also your heart rate, di ba? Ang nangyayari kasi kapag na-activate natin ang SNS natin, nagkakaroon ng ng vasodilation, ng vasoconstriction, and of course, pagtaas ng ating heart rate. That's why kapag nagkaroon ng vasoconstriction, okay, because of your mga what they call this one, mga neurotransmitters natin, no? Okay, nagkakaroon ng pagtaas ng ating resistance that will lead to increase in your blood pressure. Okay, so ang action ng ating gamot na to, from the word sympatholytic, okay, it inhibits or block the action of your SNS for us to reduce your blood pressure, sir. By how, sir? Paano po natin na-reduce yung ating blood pressure? It is through, okay, pag binakpa kasi natin ang SNS natin, nagkakaroon, instead na vasoconstriction, nagkakaroon po ng dilation of your peripheral blood vessels natin. Okay, pag nagkaroon pa po ba ng dilation of your peripheral blood vessels, magkakaroon pa po ba ng peripheral resistance? Definitely, magdi-decrease po ang peripheral resistance natin para tumaas ang blood pressure natin. So, yun po ang ginagawa ng ating mga sympatholytic drugs natin. Okay, so yung sympatholytic drugs natin, class, may mga iba't ibang klase po kasi yan, no? Number 1, we have your central acting, okay? We also have your alpha-adrenergic blockers. We also have your mixed alpha and beta-adrenergic blockers. And of course, your norepinephrine depletors. But then, ang focus lang kasi natin, class, is your alpha-adrenergic blockers. Ngayon, pag central acting kasi yan, pag sinabi natin central acting, ano yung mga klase ng central acting sympatholytic drugs natin? We have your clonidine hydrochloride and your methyl dopa. But then sabi natin, ang focus natin is your alpha-adrenergic blockers natin. Okay, your alpha-adrenergic blockers, kas, any medication that ends with osin, or malaman na, okay, osin, okay, they are considered as alpha-adrenergic blockers. Ano yung mga yun, sir? First, you have your DTPT. Ano yung mga DTPT na mnemonics na yan? Number 1, we have your doxazosin, terazosin, prazosin, and your tamsulosin na tinatawag. Basta mag-e-end ang medication ng asin, they are under your alpha-adrenergic blockers natin. Okay, so, sir, paano naman po yung action? Ano naman po yung effect ng ating mga alpha-adrenergic blockers in our body? It acts on your, peripheral vasculature. Ibig sabihin, instead sana na pag na-stimulate natin ang ating SNS, nagkakaroon ng vasoconstriction. Okay, since blinak mo, ininhibit mo ang action ng ating SNS, kabaliktaran. Nagkakaroon ng vasodilation. Therefore, these medications, they are being used to how? To what? I'm so sorry. For your hypertension, okay? To treat your hypertension, and ito pa. Okay, it relieves your prostate area for patients with BPH. Anong ibig sabihin ng BPH, sir? It's your benign prostatic hyperplasia natin. Okay, that is your benign prostatic hyperplasia na nakikita natin mostly with our geriatric male patients natin. Yan po yung tinatawag natin na BPH. Sooner or later, may re-realize ninyo or malalaman din nyo kung ano ang BPH. Okay? Ngayon, ang ginagawa ng ating ng ating alpha-adrenergic blockers, okay, bakit siya ginagamit to relieve the prostate area? It is by relaxing the prostate or the bladder neck natin. Nire-relax niya po yung bladder neck natin. Kasi pag nagkaroon ka kasi ng BPH, possible yan, hindi ka nakakaihi, nagkakaroon ng urinary retention. Okay? Sabayan mo pa ng pagkaka-activate ng ating SNS or your sympathetic nervous system, nagkakaroon ng retention of your urine. And for your patients, for them to be able to excrete their urine or mailabas ang kanilang ihi, we are going to relax your nakakontract na neck of your bladder. Okay, so yan po ang ginagawa ng ating sympatholytic drugs natin or your alpha-adrenergic blockers natin. Okay, let's proceed with your next medication. We have your direct vasodilators natin. Okay? So, your direct vasodilators class, mas potent to, mas mabilis tong mga medication na to na magpababa ng blood pressure natin. Okay? So, your direct vasodilators, ang kanilang action, they usually relax your peripheral smooth muscles natin that will lead to dilation of your blood vessels natin. Okay? For this to be okay, anong kanyang indication? Of course, para magpababa ng BP, okay, mag-decrease ng BP. By Hauser, paano pa nadi-decrease yung BP natin? Since vasodilator yan, it increases the diameter of your blood vessels. Pinapaluwang niya po ang ating mga blood vessels. And of course, kapag lumuwang ang ating mga blood vessels, nagkakaroon ng increase or decrease. Nagkakaroon ng decrease of your total peripheral resistance natin. Okay? Sir, ano po yung mga halimbawa ng ating mga direct vasodilators? Number 1, we have your hydralazine. Okay? We also have your minoxidil and other medications from this classification ng gamot na to. We have your dioxoxide and of course your nitroprusside natin. So, these two, yung first two natin, your hydralazine and minoxidil, ginagamit mo yan to treat your resistant or refractory hypertension. Ibig sabihin, nagamit na natin mostly of your anti-hypertensive drugs pero hindi pa rin tumatalab, hindi pa rin umuubra, hindi napapababa ang blood pressure ng patient natin. Our last resort will be your direct vasodilators. Okay, for this next naman, your dioxazide and your nitroprusside, these are being used as a reserve, no, for use in your hypertensive crisis. Ibig sabihin ng hypertensive crisis, more than 180, umaabot na ng 200 ang kanyang systolic BP. Masyadong mataas. Okay, para mapababa natin. And alam naman natin kapag masyadong mataas yung blood pressure ng patient natin, it can lead to many complications, no? Pwede siya magkaroon ng stroke, masira ang kidney, magkaroon ng heart attack. And we are trying to prevent that one. Kapag nagkaroon si patient ng hypertensive crisis natin. And these medications, your direct vasodilators, they are being usually given via intravenous po yan. Okay, they are given via intravenous po. Kaya nga po sabi natin, mas mabilis mag-act ang gamot na to kasi ang kanyang effect directly yan sa ating mga blood vessels natin. Okay, so this medication, sabi natin, they are being given via intravenous. And tandaan ninyo to, class, ha? These vasodilators, they should be consumed within ilang oras, sir? Within 24 hours. Kapag hindi natin na-consume yan within 24 hours, you have to discard that medication already. Okay? And aside from that one, sir, makikita natin dito sa ating diagram, okay? Yung solution mismo natin. Class, tandaan ninyo, ang kulay ng ating solution, class, it should be color brown. This is the definite or this is the dapat kulay. Okay, pinaka-exact or appropriate na color ng ating solution. Dapat kulay brown po siya. And kapag yung solution natin naging color blue, naging color red, definitely hindi na po effective yung gamot natin. That's the time that you are going to discard your solution. Okay? And aside from that one, tandaan natin class, your direct vasodilators, they are photosensitive class. Okay, these medications, they are very sensitive to light. And once they are being exposed to light, hindi na po siya nagiging effective. Okay? So, sir, ano din pong gagawin natin, sir, para hindi po ma-expose sa light since photosensitive po yung ating mga direct vasodilators? What you're going to do, okay, yung ating solution, you are going to wrap it with possible, pwedeng bag. Okay, lagay natin siya sa isang bag na maliit, yung ating solution, or pwede siyang lagyan or balutan ng foil. Okay, that is the solution of your direct vasodilators. Aside from that one class, of course, these medications, they are being, you have to use your infusion pump na tinatawag. Okay, para mas accurate yung ating mga draft factor or para mas accurate yung maibigay natin na amount na medication kay patient natin or yung tinatawag natin na piggy bank or piggyback, I should say. Wherein kapag naka-piggyback kasi yan class, via your peripheral line, dapat wala siyang kahalong any other medications. Okay, gets natin ngayon. Of course, when you're going to administer this medication, you have to think about this one class. Okay, the complications of your direct vasodilators. Ano yun, sir? It's your cyanide toxicity na tinatawag. Ito po kasi yung pinaka number one complication of your patients who are taking your direct vasodilators natin, yung cyanide toxicity na tinatawag natin. Okay, sir, paano po nagkakaroon ng cyanide toxicity when we are going to administer this kind of medication? Number one class. Okay, nakalagay dito, the metabolisms of your nitrate results to cyanide formation class. Yung pagkaka-metabolize or yung pagkaka-broken into smaller pieces ng ating mga direct vasodilators, it results in the formation of your cyanide natin. Okay? And aside from that one, kapag nagkaroon kasi ng cyanide, no? Okay? Yung sabi natin kanina, pag na-form, or kapag na-metabolize ng ating mga nitroprosides or yung mga nitrates natin, nagkakaroon ng release of your compound na tinatawag na cyanide natin. Okay? Ngayon, of course, ang kailangan natin gawin kapag nagkaroon ng, ng possible cyanide toxicity, we have to monitor the cyanate level natin every 72 hours natin. Sir, ano ba dapat yung normal na ng thiocyanate levels natin? It should be at least, okay, less than 15 microgram. Okay, sorry. 15 less than 15 microgram, okay, per kilogram per minute natin. Ngayon, kapag kapag nag-exceed yan sa kanyang level na less than 15 microgram per kilogram per minute, it will lead to toxicity. Kasi kapag nagkaroon ng excessive dose or nagkaroon ng rapid infusion of this tinatawag natin na nitroproside or your direct vasodilators in general, or once this medication is being prolonged or na-infuse yan into a maximum dose of more than 10 microgram per kilogram per minute for more than at least 10 minutes, possible na mataas ang risk ni patient magka-develop ng cyanide toxicity. Okay? Ano dapat yung mga kailangan nating i-report, sir, kapag si patient possible na magkaroon ng cyanide toxicity? Number 1, profound hypotension, biglang bagsak ang kanyang blood pressure. Next, metabolic acidosis. Next, dyspnea or difficulty in breathing, headache, loss of consciousness, ataxia, and vomiting. Any of these signs, kailangan natin yung i-report sa kanyang attending physician. Okay, so what can we do as a nurse when we are going to administer this medication? Number 1, you have to check the BP yung Q5 kasi every 5 minutes at the start of the medication, and then right after the medication, right after the administration, every 15 minutes na po yan thereafter. Next, you have to titrate the dosage, the blood pressure parameter ordered prescribed, by the medical doctor. Kailangan nating mag-base dun sa mismong prescribed ni doc kung ano dapat yung kailangan nating i-maintain na blood pressure or kung ano dapat yung level, kung gaano kababa yung blood pressure na order ni doc para kay patient natin. And then once na nagkaroon ng abnormalities na magpa siya sa parameters ng order ni doc na level ng kanyang blood pressure, that's the time that we could report it to them. And of course, if severe hypotension occurs, kapag nagkaroon ng sobrang babang BP na yung patient natin, what are you going to do? You have to stop the infusion and notify the attending physician. That ends for our antihypertensive medications.